Well, I choose Alzheimer's disease. There is not a no Alzheimer's disease. Well, the topic that we will discuss in this presentation is what is Alzheimer, causes, signs, case studies, statistics, and prevention and treatments. So, what is Alzheimer? Well, it's a degenerative brain disease that reduces the cerebral mass and is one of the most common forms of dementia. There are another three forms of dementia, and its principal signs are memory loss and reduction on thinking skills. There are also related like losing coordination, losing strength, gait, yeah, in coordination in the gait, um, which more um, hallucinations also can be reported. And well, how many types of dementia exist? As already said, there are three more types of dementia apart of Alzheimer. The second type of dementia is the frontotemporal dementia, and the third one is the Lewy body dementia. Both of them are related to the accumulation of proteins in the neurons, for example, in the second case, in specific zones that are the frontal and temporal lobes. And in the vascular dementia, this is a dementia related with Alzheimer. It is because the vascular system can't carry the sufficient blood and glucose to the brain that it starts to fail. So causes. Well, here it's important to highlight that some authors says that they are not a punctual causes of dementia, but it is interact of several facts that display dementia. And on the other hand, there are another authors that tells that accumulation of tau and amyloid proteins in the brain are related and are probably the causes of dementia, Alzheimer. Um, these proteins are related also to the reduction of acetylcholine, that is a neurotransmitter related to learning and memory. That carries to an inflammation process, and as we said before, this inflammation process complicates the delivery of glucose into the brain, so it starts to also cause damage. It is also showed that there is a damage of the microglia and astrocytes, and these are like immune cells, kind of immune cells, but in the brain. Yeah, they are in charge of clean the neurons and attack exchange bodies. And well, as we said, damage on vascular system that is related or because of the inflammation process and the shrink of the brain. Um, well, how the brain of someone with Alzheimer's looks like. Here we can watch or see this picture that compares a health brain with a healthy brain with an Alzheimer's brain. So the most easy to see trait is that the volume of the brain is reduced. Yeah, is degenerated. Okay, and here we can see two common evaluations to diagnose Alzheimer's. In the left, we can see the clock drawing test. That is important because if you see in the case of Alzheimer, the person um, forgets to draw the middle parts, yeah, the parts that indicates the hour. So that is important. And the other, in the other part, in the right side, we can see an evaluation about vicious, spatial, and executive function text, but because Alzheimer's, it is also related, or people with Alzheimer's can be disconnected from reality. So in some cases, they wouldn't know where they are, or what time is it, or in which year we are. Yeah, for example. Well, according to the said before, another authors, and including and even the authors that said that the tau and the amyloid proteins are the responsibles of Alzheimer's, converge in that there are risk factors to a person displays Alzheimer. These factors are age, that according to the age increases the risk of Alzheimer's too. Family history, that means that if in your family or in the family of someone there are past cases of Alzheimer, it is probably that someone in the um, present Alzheimer's. Genetic, and it is important because just the 1% of the cases are related to deterministic genes. That means that just the 1% of the cases is because the people in their genetic code um, have the disease, yeah, and not have and not are related with genes that make them more susceptible to develop the disease. Yeah. Head injury is also related with Alzheimer's. Heart health, it's also, there is a connection, and there are some papers that talk about the connection between the brain and the heart, and how the health of both of them are linked, is linked. And well, depression and Down syndrome is also a risk factor, and that is because Down syndrome also produces these amyloid plaques. So here we are going to see a simple pictures. So here you can see the molecular form of these proteins, and here you can see how the um, the tau tangles start to colonize the neuron, yeah, and interfere inside the neuron. If you see here, can be seen that they are inside the neuron. But in the case of amyloid plaques, we see him here. A moment, that here is better shown. We see them here like in a brown color. They interfere in the interception part of the neurons. Yeah, they interfere in the synapses. Well, according to the Alzheimer's Association of the United States of America, there are 10 signs to care because they are correlated with Alzheimer. The number one is that memory is the memory loss that disrupts daily life, and is and it is when you forget things and don't remember them. Yeah, it is normal, it is usual that we forget something. For example, making the market list, we forget to write potatoes, but moments after, we remind. We yeah, we remind that. And second, the challenges in planning or solving problems. This is related to the loss of abstraction. That means that people with Alzheimer, or with early steps of Alzheimer, start to have problems with numbers, with puzzles, with that kind of things that needs a mid or high activity of the brain. The number three is difficulty of completing familiar tasks. For example, if you in your routine you I don't know make Sudoku, you start to find it difficult and to start to find problems to complete these tasks. The fourth one is confusion with the time or place. As I said, these people can disconnect from reality and have no sense of time or dimension or space. Five, um, trouble understanding visual images. The six, new problems with words in speaking or writing. This part is important because some people with Alzheimer can derivate in aphasia, that is complex, difficult to understanding writing and speaking language. Yeah, they are like they can't understand that ways of language. Um, Seven, the misplacing things and losing the ability to retrace steps. And this is relating to the set before. For example, when you lost your keys, you start to search to research in the whole house, but there is a moment where you get illuminated and you remember where you left the keys. Yeah. In this case, you can't. You just don't remember. In the eighth, decrease and poor judgment. The nine, withdrawal from work or social activities. That means isolation. That is because when you start to present these difficulties, to have a conversation, to be in social activities, you start to isolate and to get apart from social activities. And the number 10 is the change in mood and personality. And this is because Alzheimer's is also related with another mental disorders. For example, bipolar um, behaviors. Okay, the case of studies shows that I select five case of study and I resume them. Yes, I just want to show here the principal points of these studies. The first one is the all the cases treat people above 35 years old. It means that above 35 years old were when people started to present the, the disease. The second case is that the symptoms affect the coordination, balance, movement, gait, cognitive skills, uh, memory, etc. The number three is that therapy helps, but not as a cure, but as a way to improve your symptoms, you to delay the advance of the disease. The four, it's true that amyloid is involved. In one of these studies, it is used cerebral imagining that imaging that shows how the amyloid concentrates in the brain and it is related with Alzheimer. And there is also a study that shows how a person with Alzheimer can derivate in aphasia. And the last one is the most of the cases were women. Okay, as I said, amyloid is related with Alzheimer. This video here shows and explains you how to interpret, yeah, how to make an interpretation of these kind of pictures. So I'm not going to explain it because well, it's a bit long. Um, so, what it says is basically that here in these two images, the C and D, the concentration of white masses, white matter in the brain is the amyloid, and this is when the Alzheimer starts or is presented. Then we have statistics, and in this graph that is displayed for the World Alzheimer Report made in 2015, is that the world tends to increase its cases of Alzheimer. The most affected con- no, continent is Asia, and the least affected is Africa. It is curious, and it is also important to highlight that there is another study that I didn't put here, that says that if Alzheimer was a business, it would be the most successful business because of the cost of the disease. Okay, in the case of if give me a moment. Okay, in the case of Colombia, we can see in the left graph that there is an increasing tendency in both sex, but but women have more cases that are more susceptible to develop Alzheimer's, and it is important to notice that the women cases almost duplicate men cases. Yeah. In the right table, there is the prevalence of dementia, having into account several variables. In this case, is age, status, zone, region, and principal cities. So it is important to highlight that, for example, here, as we said before, according or as the age increases, the risk to the second part the second and the third part tell us that the lower status, the more risk to develop Alzheimer is presented. That is maybe correlated for the fact for nutritional facts or something like that. Um, Here in the region, it is important to notice that the coast regions are the ones that have the higher levels of prevalence. Okay, in the case of Latam, in 2012, this graph shows us that Venezuela is one of the countries with more cases of Alzheimer, and it's just overcome by China. I don't know why China is in this graph, because there are more or less just Latin American countries. But okay, China just overcomes Venezuela in the first group. Yeah, that is between the 65 and 69 years old. Okay, in the case of USA, we can see that the woman continues having a major risk than men. And in the pie chart, we can see that the most of the cases are presented between the 75 and 84 years old. It could be um, it could be considered like a red zone, a risk zone, the the hard symptoms of the disease starts, or the really display of the disease is shown. Okay, here is also important because these graphs shows that according to the greater level of involving in the care of someone with Alzheimer, the less volunteers or caregivers are 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 for the attendance. Yeah, that it could be seen, for example, here that getting dressed has an 38% and a 30%, but when they eat move forward until dealing with incontinence, it reduces to 32% and 12% respectively. Um, it maybe is related also with the graphic in the right because um, more of the more or less more of the 50% of the people that cares of people with Alzheimer reported stress, and that is a stressful work. It could be in an emotional or in a physical way, so it could be related to that. Prevent and treatment. Well, ways of treatment involves cerebral exercise that um it is related with reading, learning new knowledge, having social activities, practice sports. Also, there are several, as we said before, the health is important, so the the implementation of a good diet or the reducing of consume of alcohol or the of smoking can also prevent the risk of Alzheimer. And in the case of treatments, there are treatments depending on what do you want to treat. Yeah, for example, there are treatments for for memory and thinking, for behavioral changes, and for sleep changes. And depending on what you want to treat, there are several treatments. There is important to say that there are no just these kind of treatments. These are chemical treatments. There are also no chemical treatments and alternative treatments, but I didn't put them in these slides. And last but not least, um, here are this video shows how you can improve your skills when you want or when you're going to have a conversation with someone with Alzheimer. So um, basically, here are the rules that the video shows that they are do not use the word remember because of obvious reason. Be agreeable, understanding that a patient of Alzheimer uh, can disconnect from events, from time, and for space. So they can tell you something that passed a long time ago as if it has passed recently. So be agreeable. Speak at a normal rate and slow because their ability to understand language and to to I remember the word. Yeah, to process the information uh, gets compromised because the disease speaks simple. That means that you try to to formulate a sentence within the I forgot my that word again. Sorry. And yeah, try to formulate sentence where the principal objective, for example, is in the sentence, is content in the sentence. Not too much questions. Use body language, eye contact, and actions because there are studies that says that a person with Alzheimer um, improves, and it's easier for a person with Alzheimer to process information about body language. Yeah. And do not make sudden and unexpected movements. So it is recommended that you tell them what you're going to do before you do it. And well, finally, thank you. Here are the references.